Hi guys, I hope you're okay. So a lot of people keep asking about sort of what topics can come up in a GPC exam, and a very important point is that the drugs that can increase or decrease the different electrolytes is very crucial because if you have a drug that can potentially cause hyperkalemia or hypokalemia, this will inadvertently mean or suggest or insinuate that you need to monitor the electrolytes. You need to monitor the electrolyte levels for before initiation, during treatment as well. So when you have the monitorings for electrolytes, you also need supplementation. So a lot of times, even some supplements such as calcium carbonate or other sort of supplementation can interact with drugs. So certain drugs like levothyroxine. So levothyroxine can its absorption can be affected by calcium carbonate. I think you need to separate the administration by around 4 hours, if I'm not mistaken. When it comes to zinc, iron supplements, antacids with drugs like alendronic acid or levothyroxine, administration must be separated as well because of sort of absorption differences. In addition, when we talk about absorption, we need to talk about pharmacokinetic differences in sort of different brands. So different brands have different bioavailabilities. If you have theophylline, different brands of that, you can have different pharmacokinetics. So pharmacokinetic differences. Now, why? Because different brands may have different excipients. It may have different carriers. So, for instance, when we look at combined oral contraceptives, they contain a carrier called lactose. So lactose as a carrier is used in combined oral contraceptives, and the problem with that is that when you have a lactose as a carrier for a combined oral contraceptive, the downside is you can taste the lactose, which may lead to compliance problems, which is another issue to deal with when we talk about compliance and adherence. Now, another point is when you have DPIs, which is respiratory, you have a carrier which is alpha lactose monohydrate, and this carrier sort of improves flowability. Now, when it comes to inhaler devices, DPIs have low resistance, if I can remember correctly. So, a DPI is also can be referred to as breath actuated. So, by breath actuated, we're talking about activated by breath. So, you need a certain inspiratory force to activate or shake up the particles in the inhaler, and this is very important when we deal with that. Also, we need to not forget that when we deal with patients that started on a combined oral contraceptive, we have to take into account if someone vomits. So if someone vomits within 3 hours of taking the pill, then you essentially need to give another pill. So if a woman vomits for any reason within 3 hours of taking a combined pill, advise them to take another pill ASAP. And now, if vomiting takes longer than a day, then they need to follow the missed pills instructions. That would be each day of vomiting would be considered a missed pill. Now, and also an important point is you need to avoid intercourse or use a barrier method of contraception during the illness interval and for 7 days afterwards. So if the illness occurs while taking the last 7 pills, the patient should omit any pill-free interval or inactive tablets and start the next cycle immediately. Now, a crucial point when dealing with combined oral contraceptives is most treatments are in cycles of 21 days. So you take a pill for 21 days and then you have a 7-day pill-free period, which is important to understand. Now, what advice or counseling points do we give a lady with a combined oral contraceptive? We need to discuss the advantages and disadvantages of combined oral contraceptives, the efficacy, and the fact that vomiting or maybe other medications or even contraceptives themselves can increase the risk of VTE and even cancer. And that is a very crucial point to talk about. Now, when we look at combined oral contraceptives, there is estrogen monophasic 21-day preparations, and that's ethinyl estradiol by itself. When we look at multiphasic, that could have levonorgestrel and ethinyl estradiol, and these are very important points to look at. So advice with combined oral contraceptives is key. How would you manage a woman who is pregnant whilst taking a combined oral contraceptive? You advise her to stop taking the pill and So if a woman becomes pregnant whilst taking the combined oral contraceptive and she wishes to continue with the pregnancy, then you would advise her to stop taking the pill and advise her there is no evidence of harm to the baby or the mother if pregnancy occurs whilst using the combined oral contraceptive. So you need to counsel the patient well. Now let's quickly go to sort of levothyroxine for a bit. So levothyroxine is used for hypothyroidism. So hypothyroidism is known as Hashimoto's disease, right? So hypothyroidism is different to Graves' disease. So hypothyroidism is when you generally have low T3 and T4 and high TSH. That is a very, very important point. So when we're referring to Graves' disease, we need to understand that Graves' disease is referring to hyperthyroidism. So high T3, T4, low TSH. Hypo is low T3, T4, and high TSH as well. So that's a very, very important point. So levothyroxine is for hypothyroidism. Now, if we quickly take a look at amiodarone for a bit. So what can amiodarone be used for? Amiodarone obviously is used for arrhythmias. That's the first point. So it's used for people that have abnormal heart rhythm. It also has different toxicities. So the main toxicity you need to know is for thyroid function. So it can cause hyperthyroidism, hypothyroidism, etc., etc. So you need to know that. Now, why? So the important reason with why you need to know that is because when you kind of have a patient on amiodarone, you need to monitor the TFT levels in intervals. If I can remember correctly, I think it's in 6-month intervals, right? So that is a very, very important point. It's a bit like carbimazole. So for example, if you have a patient on carbimazole, you need to look out for a few issues. Now, what is the issues you need to look out for carbimazole? You need to look out for acute pancreatitis, as well as clinical or laboratory evidence of a granulocytosis or neutropenia. So there are these sort of points that you need to look at when dealing with these drugs. So acute pancreatitis generally can present as abdominal discomfort, and obviously clinical or laboratory evidence of granulocytosis or neutropenia is seen as lowered white blood cell count. Now, what are some of the